Well, welcome to today's webinar, Introduction to Collective Impact, brought to you by the National Council of Social Service and the Tamarack Institute. My name is Hui Ping, and I'm the Director of Service Planning and Standards at the NCSS. It is my pleasure to introduce Paul Bond, a global leader and an award-winning author on issues of community. Paul was conferred the Order of Canada in 2019. And congratulations once again, Paul, for that. It is indeed a pleasure to have this partnership with Tamarack Institute and Paul. And without further ado, I will just invite Paul to give us the presentation for this morning. And over to you, Paul. Please share with us what is collective impact.
Well, thanks so much, Hui Peng. It's lovely to be here. It's lovely to welcome all of our guests from Singapore. It's been a real pleasure working with you and your team, Hui Peng, as we put this webinar together, as we've been learning together about the value of collective impact and how it will resonate in Singapore. I wish I was being there I wish I would be there in person right now, you know, but we're all at home. I think you're all at home that you're listening in. We have many here, around 600 people registered for this webinar, about 450, I would say, from Singapore and another 150 from Canada. And all of us are at home due to this COVID-19. I hope you're keeping safe. This is really a serious time. It's a difficult time for both of our countries. And we are in solidarity, as they say. We're all in this together.
Yeah, indeed.
So glad to be able to share with you about collective impact and the work of collective impact. Already a little bit was said about our institute. We're a learning center. We also are an action center. So we have a learning center in the sense that we produce a lot of webinars and a very active website on this issue of large-scale change. We're particularly interested in collective impact and have been for almost 20 years. It's an interesting thought for us. You know, it kind of started by getting lost as an organization. Back in 1996, I was running an organization that had won the 40 best practices in the world. Nicholas Yu flew out from Nairobi to give us the award, but we were confused. How do you get to become one of the 40 best practices in the world when poverty actually went up in our community? And we were one of the largest agencies in economic development organization that was trying to end poverty. And so we thought for a while, what do we need to do? Like, how are you recognized to be the best at something, you know, one of the 40 best in the world, and still not have success? So we decided to get lost for a while. And that's what I want to encourage you. As you're looking at this idea of collective impact, don't compare it so much to what you already know. Don't try to think, oh, I already do that or I don't. Think more about, why is it that so many of the problems that we're trying to solve aren't getting better on a population level? Why are they entrenched the way that they are? Just let yourself explore this new idea for a while. You don't have to agree with it, but it helps you to understand it. And so in that sense, I'm asking you to just join this journey. Take a year to discover new ideas, meet new people, release the ways of thinking that no longer serve you, and open yourself to new possibilities. That's what we did. And in turn, we launched our idea nationally. with some amazing partner foundations and loads of individuals. And before COVID, in January of 2020, it was announced that poverty had dropped to its lowest level in the history of Canada. And we did that using a collective impact approach. So I want to kind of look at this, and I want to kind of ask ourselves, for what kind of problems should we use a collective impact approach? And so this is something that a mentor of mine taught me. Her name was Brenda Zimmerman, and she talked about 3 kinds of problems. And when you start looking at kind of system problems, there are these types of initiatives. The first is a simple problem or a simple system. Basically, it's like making soup or baking bread. If you have the right recipe and you follow it, right, you know it's a known entity, right? And so you engage with it. And as long as you keep following the rules, essentially, you will have an element of success. Another type of problem is a complicated problem. And we talk about that as sending a rocket to the moon. It's basically a knowable problem. It's very complicated. It takes time to understand, lots of study, lots of mistakes. But eventually, as we do it more and more, we're able to know what to do. And we can replicate it often. And then there is this idea of a complex problem. This is really the problem where we use a collective impact approach. And Brenda would always talk about this as raising a child. And, you know, often if you're in a room, I would kind of ask, how many of you have 1 child? How many of you have 2? How many of you ever think, how do these 2 children come from the same parents? Right? Because in so many ways, they're different, right? There's something similar, but they're different. And it's kind of like, it doesn't matter how many books you read on raising children, every child is different. And so you need to engage with that child. You need to engage in them. It's unknowable unless you are present and you are there with them. Let's just take that a little further. So here you see that kind of a complicated, simple problem where there's a high level of certainty and a high level of agreement on what to do. You see those 2 at the bottom left corner, high level of agreement and a high level of certainty. But where complexity is, where there's a low level of certainty and a low level of agreement. You see at the far ends of that diagram. And that's really where we start to think about complex issues. When we don't really have agreement about what to do, we don't have real certainty about what to do. And I would say that right now in a pandemic, it's very complex. We're not sure what to do. We don't have full agreement. We don't know what's going to solve this. We have all kinds of ideas, but we're not even sure if those ideas will work once they're put into play. So the thing is, complex community issues are very difficult to frame. Even how do we describe them? There isn't a consistent language for them. There's a lot of interconnected root causes that require interconnected responses. You start to see the collective impact language, interconnected root causes requiring interconnected responses. Many stakeholders need to be involved in addressing the issue. We always call that a whole systems approach. We need the whole community to end poverty. We need business leaders. We need community leaders. We need people living in poverty. We need all levels of government. Everyone needs to be involved together in this complex issue to reduce the number of people that are poor. We need to create a dynamic and adaptive environment. So in a sense, we need to be able to engage in the issue, learn really quickly, communicate a lot with each other, try to really understand and dialogue, test things, And then eventually we see a path forward. And as we see that path forward, we collectively move in that direction. And what's so interesting about complex issues is that they're unique to the local context. They live out differently in almost every community, in every neighborhood. Because in every neighborhood, there's different dynamics. There's different dynamics of how people are living there, their level of income, their level of education. All those dynamics are unique to that local context. And so you sort of say, we can't address COVID the same everywhere. That's kind of the interesting thing. More when we get to that later. So the question is, when we find a complex issue that we're trying to address, I kind of think we have three options. One is that we keep working in our silos and we just work harder and longer and hope that the problem does not get worse through sheer volume of effort and resources. You've been there? I've been there lots of times. Just think, if I work just a little bit harder, if I just get a little smarter, I'm going to be able to solve that problem. And that's where we were way back when Nicholas Yu came to us, and we had won this prestigious prize, and they had studied us for 10 years, and they kept saying, you know what you're doing. But we didn't. We had to break out of our silos. And so, the idea is, do we collaborate? Well, we already were collaborating. As one of our partners said, he was the CEO of the hospital, he said, we've been getting together and meeting for a lot of years. And though I've really liked all of you and we've done some good work together, we've never actually accomplished anything together. So interesting, huh? We were collaborating, but we weren't actually achieving a collective impact. See what I mean? So that word collective impact, you want to coin it and you want to say that's a methodology. But no, collective impact is actually the outcome that we want to achieve. When we pull a whole community together, we collectively have an impact. And that's our third option here in a complex, as we're addressing complex issues. We convene and support a whole community response. And we produce solutions and we reorient, right, our organizations to work together on this issue. More on that when we get to questions later on. So many of you have read about collective impact. I've sent you, or Rute sent you documents, Wipeng, Nadira, she sent you documents around this process. I think most of you read the initial papers by John Kanya and Mark Kramer. And they're really these 5 elements. Firstly, it's about a common agenda, which means that as a community, we talk, we learn, we engage together until we agree what needs to be done. Now, a common agenda is not like a strategic plan. Whereas a strategic plan, you might write it out, at a fairly high level of the organization, and then everybody kind of works toward that plan. A common agenda is really more about people committing to a new future together. They're committing to work together, right? And they're focusing on a number of high-level activities. Now, a common agenda and a shared measurement, I call those sisters, because while we're talking to one another and learning from one another, we're also studying the data. We're really trying to understand on a numerical basis what's happening in the problem. And so we bring that shared measurement work into our common agenda, and eventually we agree, this is what we want to do together, right? And these are the measures that we're going to put into play in order to understand whether we're having a collective impact. Common agenda, shared measurement, and then mutually reinforcing activities. And this is really where we're all working together, and more on that in a little while. The other two sisters are continuous communication and the backbone role. These are what make collective impact easier and more effective. Continuous communication is just that simple. For a system to work together, it needs to communicate well. In order for a system and a whole community to work together, it needs some form of a governance model. It needs staff. It needs help bringing together, like a contractor building a building. You need someone to coordinate all of this. And that's really what that backbone role is. But let me take you through each one of these in a little bit more detail. So I was working in the state of Maine, and our goal was to reduce the effects of cancer by 20% on the entire state. Interesting, huh? We wanted to do that by really learning how cancer was having an effect on people's lives. And so what we first of all did was mapped out who needed to be involved in this conversation. And we understood that medical professionals needed to be involved. We needed to find people who were actively fighting cancer, those who had beat cancer. We wanted to get the people who loved the people that were ill. And we started talking to them and bringing them together into a real conversation about what was going on. I remember at one point, we learned that there was well water that was tainted, and Maine had the highest rate of bladder cancer in the country. And so we were able to work with well diggers and drillers to help them put a certain filter on the water in order to make it safe again. Now that seems like a really simple kind of solution, and it is. But the complexity of it was to learn it, to hear about it, to understand it, to uncover it, because we were all talking to one another. And so people didn't really even understand what it was that was going on, but the medical professionals did when they saw it. And so it was kind of the whole system in engagement found some key solutions that they needed to work on. Very interesting, you know, and you know, at the same time, we engaged the business community that they had screening days in which people in their companies could take time off, or medical professionals would come in and they would do basic screening to try to do early identification of who had cancer. What was so interesting about all of this is that through that dialogue and through that experimenting, we were able to come up with a whole series of initiatives that we started to undertake. And we found so many solutions together and were able to implement them quite rapidly because we had a common agenda and we were working well together. I talked about shared measurement, and I'm going to read this. It was written by Kanya and Kramer in 2011. Developing a shared measurement system is essential to collective impact. Agreement on a common agenda is illusionary without agreement on the ways success will be measured and reported. Collecting data and measuring results consistently on a short list of indicators at the community level and across all participating organizations not only ensures that all efforts remain aligned, it also enables the participants to hold each other accountable and learn from each other's successes and failures. And I don't think there's any better way of saying the value of shared measurement. Now, normally the way that we work at this is that we put a data team together in a community. And that's a small group of usually 4 to 5 people who really understand data, who love it, who love to kind of explore it. And we start asking questions. Why is it like that? How many? Has it ever changed? Right? So we ask these questions, and we start looking at population level data, and we start to see patterns. And those patterns start aligning with what we're doing in the common agenda work. So we're understanding at both levels. We're understanding at a level of numbers and at the level of stories. Common agenda and shared measurement. When those two are working well together, we have a deeper understanding and we have a deeper commitment, and we start to set the criteria for our success. And thus we start working toward that success. Now, at some point, when you convene a whole system, and in poverty, this is a great one, when we work at poverty roundtables all across the country, we bring business leaders together. We bring government leaders together. We bring people living in poverty, and we bring people together who are community organizations. Now, what's unique is that we don't bring them together separately. We bring them all together. So in the room, in our leadership structures, we have people from business, from government with lived experience of poverty, and community organizations. All of them coming at the issue of poverty through a different lens. And as they're doing this, they're starting to see roles for themselves. Business leaders start saying, geez, I gotta pay better. I gotta stop offering part-time. I have to do better training. Maybe I have to hire not just through education and work experience, but I have to look for characteristics that people might bring. So I can find a good employee and then train them. So there's all these different kind of roles that everyone plays. But what's unique is when you start working together, you see opportunities to work together. It's that simple. Once you get to know each other, once you start building trust, you start finding ways and activities where everyone can help. It's lovely when people want to look at, we have people that are homeless. And when we use the collective impact approach, we have landlords, right? Working with community agencies, working with governments, and there's just a myriad of new ideas that start to come up. And we're able to solve homelessness in a very unique way. Continuous communication is just really that simple. We're learning together, we're sharing data continuously, we're meeting regularly as a whole system and communicating with others, and we're developing a communications plan around how we stay informed, that everybody has the latest knowledge, everybody has the latest stories. And in doing so, the whole system seems to be growing together and learning together as yeast raises flour into bread. Continuous communication helps a common agenda and a shared measurement system to engage and to enable. And the last point. So let's go to that again. A common agenda, shared measurement, mutually reinforcing activities, continuous communication, and the backbone role. So the backbone role is interesting. And I know that, many people, when they first hear about collective impact, they hear about that backbone organization, and lots of not-for-profits will say, well, we want to be the backbone organization. And I'm always saying, look, there's many roles in a backbone, not just one organization. Often there's a fiscal sponsor, someone that's kind of, that takes in the money that all the staff work for. So that's one role. There is a small staff team that is reaching out and working and supporting all the activities that are coming out of the collective impact approach. There are working teams and work teams that are part of that backbone structure. And each work team is taking on a different initiative in the common agenda work that you've agreed to. But essentially, it's kind of a governance model that collectively guides the vision and the strategy, keeps everybody focused and working on the same thing. Often it works at a policy level, right? So that this is where we collectively can work on policy. We can talk to government, we can talk to different organizations. Collectively, we mobilize resources for the whole, financial resources mostly. we're building an engaged community. Because one of the things around common agenda, if you want population level change, this all has to spread far and wide for that to occur. And to establish and carry on and evaluate to find that these shared measurement practices are working. There's many ways of using collective impact, and I'd love to talk about this some more, but maybe I'll wait for the question and answer period. But you know, the idea, like the more you learn about collective impact, the more you're going to be able to use the ideas in your everyday work. This idea that you can bring a team together and form a common agenda. That the common agenda is more than a plan, it's a common commitment to a goal, right? To understand that we need to really work with data and bring that data into our work and care about numbers and outcomes in our work. This whole system response is a whole nother thing. But at the end of the day, what we do is we see that if we're going to do a full-blown collective impact campaign that has you engage with your community, that has you identify all the system players, that brings the whole system into a collective impact focus, we're going to want to work with really these types of large issues that we're trying to undertake and solve. I know that, you know, many of us work on a transactional level. That means that we provide direct service to clients. And so we think about that and we think about how we serve our clients well, and we need to keep doing that. But collective impact allows us to start thinking about systems and how systems change. Many of us collaborate. We talk to one another, we learn from one another, we try to help each other. Collective impact helps us to move from collaborating to actually working together as one system toward a common outcome. So often we are used to central planning. We're given strategies that we need to implement. Clients are supported. Collective impact can help us move that to a much broader level of community engagement where everyone has a role to play. And then lastly, you know, we move from this idea of kind of doing things over and over again and expecting a different result. Collective impact can help us move into a community innovation space. I think this is really an important part. For me, it's the most important part of collective impact. By bringing everyone together, by involving sectors that have not been involved in an issue before, by involving the person who's going to benefit the most if we're successful, we start to think differently and we come up with new approaches. And those new approaches are what ultimately give us our success. Weipeng, that's kind of a, I hope I didn't go too much over time. That's kind of an overview of collective impact. Let's dive a bit deeper into it with your questions.
Yeah, thank you, Paul. Before I go into the first question, I just want to make a quick comment about today's audience. I'm very happy to have representatives from policymakers, foundations, intermediaries, and practitioners from the social service agencies. And really, these are different constituents of the social service ecosystem. So very glad to have the audience today. Thank you very much for spending time with us. So the first question that I have for you, Paul, is...
Hey, Weipeng, do you want to put your camera back on? It'd be lovely to see you.
Oh, okay, right. Sorry.
I'm feeling a bit lonely here. I'm just looking at myself.
Okay. Yeah, okay, my first question to you, Paul. I think you mentioned about it, but really, there seems to be a lot of similarities, but what is the difference between collaboration and collective impact? based on your experience, how do we know that this is a collective impact? It's not collaboration.
Yeah. I guess, I'm going to go back to the CEO of the Orangeville Hospital. And we were all sitting in that room together, and he was looking around the table, and he said, and we're all health professionals. And he said, look, we've been collaborating, we've been learning together for almost 10 years, right? And though we've done a lot of good work, we haven't actually done anything different. Like, we haven't actually created anything. So what I find is, for the most part, that collaboration is people talking together, learning together, networking together. But I think what collective impact says, I think collective impact is an evolution of collaboration. I often look at it as the next step. So if we collaborate long enough, eventually we're going to say, let's get to the root of the problem. We have homeless people in our community. We're all working at homelessness, but we're not reducing the number of homeless people. We're just making their lives better. So can we all work together, put our agencies, needs on hold a little bit, and try to see, what if we change together? What if we talk differently? What if we actually started to have a shared measurement together? When's the last time, Weepeng, that you were part of a collaboration that had a shared measurement? That you actually agreed on what the outcome was going to be. And that you really, studied that. So I think, in Canada, we've been forced to collaborate. Like, our funders will say to us, you have to collaborate or else you won't get funding. So we all start collaborating. But it doesn't really make any difference, other than, to be a bit cynical here, it just causes more work. But when we start to think about collective impact, we actually think about, how do we change things? How do we make things better? If there's food insecurity, how do we stop food insecurity? Not just help people to eat, but we actually get to the root of the problem. And that's kind of where the other big thing is that I also find that probably 90% of collaborations are single or sometimes dual sector. So we still collaborate in our silos. And what collective impact tells us to do is to break out of our silos and to have the whole system in the room together, right? Including the people that are going to benefit the most if we're successful. So I think that there is a lot of similarities, for sure, between collaboration and collective impact, but you'll know that we've moved beyond collaboration. So that's maybe the best way to answer this. It's not so much what's the difference, but it's about, how do we move beyond collaboration? And if you ask yourself, what's next, right? We've been collaborating for 10 years. That's what the CEO at the hospital had said. It's got to be something more than this, because we aren't getting much done sitting around this table together. Does that ring a bell at all for you?
Yes, Paul. In fact, I resonate with you on this point, that it's not so much about the difference, but how do we go beyond collaboration? And it is subtle, but very important, because it's about a mindset shift and willingness of some agencies to take up the leadership role, to do more than perhaps what the fair share of things, to want to be a change agent in that ecosystem. And then when we have agency prepared to take up that role, I think it is a start to a different conversation of how we collaborate. Yeah, so I think it's about changing. Yeah. So
why is NCSS interested in the concept of collective impact model? And why do you think it's important for Singapore's social service sector to adopt a collective impact approach to solving complex issues.
Oh, Paul,
You really showed a lot of passion for this work.
Well, my colleagues and I are very passionate, and I know a lot of friends in the social service sector who are equally passionate about this. Because just like you said, after spending years in the social service sector, we realized that there are issues that continue to exist despite very hard work being put into it and commitment from different agencies. But these issues are complex. And individual effort by agencies is not sufficient to deal with those problems. We recognize that. And we also recognize the importance of collaboration. But after a while, we realized that collaboration is not giving us that kind of benefits that we thought it would be. And where is the answer to this? So this idea of collective impact is very apt in helping us to answer this, because it's about a lot of things, but the core of this, I think, is change. When people come together, when organizations come together, it's not just about collaborating at a superficial partnership level, but it requires change on different parts of the ecosystem. So from NCSS perspective, it's about how do we engineer this? How do we make this easier? How do we create a structure to this so that organization can come together and collaborate in a more effective way to reach a collective outcome? I think that's what we want to do. Hence, I think it's the start of building this capability and introducing structure to this process.
Mm-hmm. And you must also have a whole series of entrenched problems that don't seem to get better.
Indeed, we have many issues. I mean, our social service sector is pretty well structured. I mean, yeah.
One of the best in the world.
I mean, we have the benefit of being a city state, so things are a lot more efficient. But there are still issues, and some of these issues are complex and more recent, and that's because we have new demographic profiles, we have emergence of new social values, social norms, and different stakeholders have different views about those issues. So, so how do we get people to come together and talk about the issue and come to a consensus of what needs to be done going forward? I think that's very important. Yeah, but we can't do this in a very organic manner because it'll be inefficient, I think. So from NCSS perspective, we want to see how do we help to facilitate more of this kind of bottom-up initiative to address different complex issues.
It's important,
Yeah.
One of the things that we've learned in collective impact that, I would say has made the biggest difference, and is to involve the people who are going to benefit the most if we're successful. Sort of that bottom-up community engagement, working at the neighborhood level if we're trying to resolve something, trying to really listen to people. I remember a business person was the one who first brought it up. We had been 2 years into our first campaign. And they said, well, where are the people we're trying to help? And I said, what do you mean? Well, why aren't they at the table here with us? Aren't they the customer? And I thought for a while, well, I don't know. I've never thought of them as a customer, but let's just think about what a customer is. And so we came to realize that when we're doing collective impact work, whether it's working on poverty, then you would bring the person that would benefit the most if we're successful, which is someone who's poor. If we're working on the environment, it's probably young people, right? If we're working on violence, it could be a combination of, I mean, I've brought gang members into collective impact approaches, and they've been incredibly helpful in helping us understand how to address the problem. So it's unique, and then the question is how? How do you get to that grassroots level? And how do you engage with people? Well, what I often say is that if we bring all the right people around the table, and we have this exercise called Top 100. And so we just brainstorm, who are the 100 people that if they all agreed that something needed to happen, we're pretty sure something will change. But here's the kicker. We want 25% government, 25% business, 25% lived experience, 25% community agencies. So now the brainstorming gets a little harder, because you can always get the community agencies real quick. You can get all the governments real quick. Pretty much a lot harder to get the business people who are going to come around the table. And then when we start looking at people with lived experience, people often go brain dead, primarily because they don't see them as actors. They see them as beneficiaries. So when we see someone as a client that we serve and we bring expertise to them, we so often forget that they can bring expertise back to us, because they are like a client. They are like a customer in business. The customer is always right. The customer knows best, right? You've heard those words before, or are those more Canadian sayings, you know? But you get what it is. So when you start thinking, well, maybe my client knows better than I do what they need. And yet, as a social service system, we are often immune to that type of thinking, because we have been trained to be the experts. We are the ones helping. We don't evoke help from those people who need help. So once you start thinking that way, then you start to realize that everybody around the table knows people that are having challenges. We know people living in poverty. We know people feeling unsafe. We know people who are struggling, right? So when we know those individuals, now we can start making contact with those individuals, and we can start moving inside of systems, right? And we start going to neighborhoods for consultations. We start going to schools for consultations. We start figuring out places where the people who we're trying to help live, and we start moving into those spaces to learn with them. Eventually, we get people that we have find that are the natural leaders in those spaces. And those natural leaders now start opening doors for us and finding pathways to understanding. And I can't say that there's anything more important, that once we have a line of communication with the people who are benefiting from our work the most, now we start moving toward ideas that are obvious, that maybe are so obvious we missed them. And often those are the ones that change things the most. Right.
Thank you, Paul, for the lowdown on how we can actually initiate a collective impact kind of a project by really engaging the people who are really experience the issues themselves to be part of it. I would like to now go into some of the questions that have been put up by our audience. Sure. I think they are very good questions. One of the questions has to do with the backbone organizations. How do we fund backbone organizations so that it remains neutral, right? And a related question, what type of organization are best suited as backbone organization? Maybe can you give a take on that?
Right. So again, a backbone organization is more than one organization, right? So think about the backbone structure, right? Which includes the fiscal sponsor. It includes staff. It includes the leadership roundtable. It includes a lot of action teams or working groups. It usually includes the data team, and it includes a what we call a listening team, one that is doing deep community engagement. So let's think that through again. I'm going to say it one more time because it is so important that you get this early. Because I know in North America, the backbone, it caught on fire. Everybody wanted to be one. Every organization wanted to convert to be a backbone. And I'm saying there's many roles. One might be the fiscal sponsor. Maybe that's what you're asking, right? One might be the staff team. One might be the leadership roundtable. And I can talk about each one of those. But let's start with the fiscal sponsor. So in Canada, the fiscal sponsor needs to be a charity. So it needs to be one that can actually receive money and is qualified to receive money. And in Canada, that means that you have a charitable registration number, that you can issue charitable receipts to private people that give you money. Maybe in Singapore, you have both private people giving you money, but government primarily gives you money. So you have to be able to receive money and manage money well. So that's a criteria, usually is large enough. Secondly, most of the time the staff team follows the human resource policies of that organization. And you also keep the finances. But and then often that organization will appoint one or two people to the leadership roundtable. So I would suggest the leadership roundtable, if you want to say if there is a key backbone role, that's the key one. It's usually made up of 8 to 12 people. Usually it's 2 people from each level of the sector. In our work, it's usually 2 people living in poverty, 2 people from business, 2 people from government, and 2 people from the not-for-profit sector. That gives us our 8. If we're going to have a 12-member, it's 3 from each, right? If we're going to have a 16-member leadership roundtable, and that leadership roundtable is the one that is continuously learning, listening, doing sense-making of what's coming through, and is responding and bringing recommendations back to the larger collective. Because often in a collective impact, you'll have upwards of 200 to 300 organizations now collaborating together. So the Leadership Roundtable represents those organizations and the plan and the common agenda that they've agreed to implement. So that's why when you go back here and you start to see, hold on. No. Right? When you start to see all these things we pegged, like guide, vision, and strategy, advance policy, mobilize resources, this is the whole structure, the sort of the governance model that's moving the big items forward. And then you've got maybe 300 or 400 member organizations, and all of them are implementing different elements of the action plan together. I know it starts getting more complicated. I wish I had a whiteboard that I could draw it all on for you.
Oh, I think this is fine. A related question. If we were to encourage foundation or donors to provide funding for the backbone function, I mean, typically the funding goes towards the direct services, right? So if we were to encourage funders to tell them it's important for you to support collective impact effort, and one of the area that you can consider funding is the backbone function. Which of these are actually typically funded by foundations back in Canada?
Yeah, the backbones need a budget. So normally we'll hire 3 to 4 people to start, right? Depending on the size. Sometimes it's just 1 if it's a very small one. But it'll often be staff that do a lot of the support work, because there's a lot of meetings that have to be called. So it's about just keeping everything organized. There's often a director who is helping to facilitate and draw out ideas, fundraise, work at policy initiatives for the collective. There's often staff that work with the working groups. So let's say again, if we're going to deal with something like poverty, there might be a working group that's related to housing. There might be a working group related to transportation. There might be a working group that's related to food security. There might be another working group that's focused on income. There's another working group that's focused on housing, right? So there's different working groups, and those working groups are then made up of maybe 15 to 20 people that are from the private sector, the public sector, and so forth. And so all of these people need to be coordinated. And so then staff get appointed to the working groups because the working groups come up with ideas, and someone has to do the research in the background and take the minutes and do all that coordinating work. And so the benefit of a foundation funding a collective impact approach is that they are funding the system to work collectively toward a joint impact, right? So they're actually trying to fund what we call systems change, or what we like to talk about is population level outcomes, right? So how are you going to, if you have a group of immigrants or refugees in your community, and you're trying to build them into everyday life, and you're trying to say, how do we change the conditions so that refugees have an easier way to become successful in our community? How do we think about that as a whole system, as a whole country, right? Addressing that. And so though we can do transactional work, which is meaning that we give the refugees training, and we give them food, and we give them housing, and we give them clothing, and all those other things, right? You've heard the saying, and sorry, I'm rambling here, but I'm going to end with this. You've heard the saying, give a person a fish and they eat for a day. Teach someone to fish and they eat for the rest of their lives. Have you heard that saying before?
Yes.
It's very famous here in Canada.
Yes.
So then I say, wow, but then you have to assume there's fish. So who's taking care of the fish in the lake? Who is regulating? Is the regulation fair, right? Who is making sure that there's good equipment for fishing, making sure that the conditions for fishing are right, making sure, you know what I mean? So at the end of the day, you can teach someone to fish, but if they're not allowed to fish, or there aren't any fish, they're not going to eat any more than if you gave them the fish, or less even. So collective impact is working at that larger system, right? It enables us, we have to keep providing great human services, transactional services, to help people in their time of need, but we need to create the conditions for success.
Thanks very
and
much,
I'd love
Paul,
to
for
tell
that.
you about one of my favorite stories of collective impact if we had time, but you keep going.
I certainly would like to hear the story that you have, but I have one question before that. I think this is like a summary of a few similar questions. Really, the essence is, how can you help to facilitate the process of coming to a conclusion on a common agenda and shared measurement among stakeholders who may have very different interests? There are differences in power dynamics. How do you navigate this if you are the leader trying to get this all together? How do you do that?
Yeah, well, that's probably the best question you could ask. And it takes, in some senses, time and practice. But mostly it takes patience. So first of all, we need the right people in the room. There's nothing, to get the wrong people to agree. So what I've learned, Wee Peng, is that when everybody's the same, so if we just bring human social service agency people into the room, charities, not-for-profits, everything is too much alike. And it's very hard to get them to agree. Even if you just bring all business people into the room, it's very hard to get them to agree. Everyone thinks, in a sense, when it's single sector dialogue, there's far too much trying to win the argument type behavior. But as soon as you make it multi-sector, so now imagine we've got a room where we've got people who are business, government, not-for-profits, and people with lived experience of poverty. And we agree to go on a learning journey together. So that's the big thing. We move from knowing to learning. Let's suspend for a while. Let's get lost for a while. That's why I talked about that at the beginning. I say that to every group I start with. Let's get lost for a while. Let's just engage in ideas. Let's explore. Let's really understand this issue. Let's talk to everyone that we know. Let's release some of the things. And then eventually, I mean, we all know what we know, and we're all very smart. So we're not going to become unsmart, but we're going to open ourselves to this journey of discovery, of innovation. And so we move together in this journey, because most of the time, you know, when we talk about this around poverty in our community, you know, when we'll say, how can a place as wealthy as Canada have so much entrenched poverty, right? I can say the same about the environment. How can such a beautiful country as Canada have so much pollution? How do we think like that, right? You know, how do we have a country that has so many services have so much inequity? So we ask those big questions. And if we can convince people to go on this journey together and learn together, they will eventually come to a common understanding. I've seen it happen. I've almost never not seen it happen. If we rush it, if we come up with answers too quickly, we will never agree. But if we can actually sustain the learning journey over time, using the collective impact methodologies that we've come to understand, people will come to agreement. We've seen that in hundreds, if not thousands, of communities now.
Thanks, Paul. I think that really takes leadership, agencies setting the tone and prepared to let down their boundaries, their comfort zone, and hopefully that also influence other like-minded agencies to join that collective effort. Yeah. It sounds
and often what we'll do is we'll invest in, like, you know, in the state of Maine, they invested a lot of money in a lot of people learning about collective impact, right? Yeah. Just like Singapore is doing. Like, the more people that do collective impact, the more people that learn about it, the more they get into the depth of knowledge about it and that approach, the easier it is for them to work together, come up with a common agenda and a bold action.
But how would you tell people who feel that, you know, isn't this kind of work the responsibility of the government, the state? You know, they should be the one organizing such collective efforts, yeah. Right?
We get this all the time. And I always say, well, the government is, you know, the state has a limited role. If you actually look at the legal function of a state, it's quite limited, right? And often it's to take care of infrastructure, to take care of policy, you know. But in order for a system to operate, it requires everyone to act together. Wouldn't it be sad that if in Singapore, if people waited for the government to do it? But in some senses, who is the government? It is us, right? We know that. The people need to be engaged, need to be active, need to care. And if they are caring about things, the work of the government becomes so much easier, right? Otherwise, we have to hire for absolutely everything. And I don't think you can actually hire caring. Caring is an entity that is like water to fish. And I think that the collective impact approach builds caring, builds commitment of citizens to want better. What
Paul,
better? Probably not
right.
good English.
Thanks. Okay, can I ask you to share with the audience? They really want to hear this. In a good example of a collective impact effort that you're involved in how you actually foster this shared agenda and shared measurement. Getting people to let go of their organization interests. At least, I mean, think of the larger good. How do you do that? Can you use an example to illustrate?
You know, I'm going to go to Des Moines, Iowa. It's not a Canadian story. I've got many, many Canadian stories, but this one in Des Moines, Iowa was a real miracle. And what they wanted to do is they wanted to make people more economically self-sufficient. They wanted to remove barriers to people being successful. To make sense? They called it Opportunities Central Iowa. And so they wanted it, so they kind of thought that not that there are a lot of barriers to success in people's lives, and that's what's holding them back. So what they did is we started out by identifying what we called our top 100. And we looked at the business people in that city that cared about this issue, which was almost all of them. We looked at who we had good connections with. We looked at the not-for-profits. We looked at all levels of government, including the state government, and people who were experiencing barriers to opportunity. And once we identified them, we invited them all to a meeting. The meeting lasted a day and a half. At the beginning of the meeting, we told some stories about what we looked at the math. What's really happening in Central Iowa, right? By the numbers. We looked at how is Central Iowa an engine for innovation and change, that it can change. We wanted to prove that. We had another presentation about examples around the world where cities were more equitable than Central Iowa or Des Moines. Then we went into a series of questions. We put at each table of 10, 2 people from government, 2 people from business, 2 people from lived experience, 2 people from the not-for-profit sector. We had a recorder and a table facilitator, and we asked 3 questions. The first question we spent an hour on, what's happening now? So again, when you start seeing all the sectors talking to one another, you can see immediately how you're getting almost a 360 view of the problem. And they're all understanding the problem more intuitively, and they're listening to one another. The second question is, what's the change we want to see? And the third question was, what can we do together? Essentially, that's what we did for a day and a half, was looking at those questions, debriefing them, right? And then brainstorming ideas that came out of it. You know what was interesting? When we were done and they were thanking everyone, there was this pent-up energy in the group, and immediately 120 people who were in that room gave a standing ovation to each other. So just think about that collective energy of a day and a half together in dialogue, often arguing, and people stood up and said, we've never had this kind of a conversation in our city before. That's been so intense and open-ended and exploratory. That then launched into creating a leadership roundtable. I had described that before, from all the sectors, hiring a small staff. We immediately raised about $1 million to support the backbone role from different foundations and corporations, including John Deere Tractor, which is a big one. It's the motto of Des Moines, Iowa is feed the world. And then they started. And they spent a year, they put a listening team together. They put a data team together to keep learning. They put action teams together, 4 of them, that focused on different things that they could change and barriers that they could remove. And they kept working together until they launched their community plan. It was called Opportunities Iowa. Every quarter, they brought all their members together. Over 200 member organizations and corporations joined the collaborative. Over 200. And they met every quarter. It took them 2.5 years to change the circumstance. But after 2.5 years, they achieved over 20,000 people in 1 year became more economically self-sufficient. And they repeated that over the last 2 years. So a massive change in their community. But they did it by working together, by working collectively, by deeply understanding the problem, and all of them working together to implement their plan and their strategy. So much of it came, they just kept learning. And when they kept learning, they kept understanding that you don't just learn for the sake of learning, you learn in order to change. And they transformed their community to the point where, I can't believe it. It's a big insurance town. One of the largest insurance companies, their CEO just up and declared that everyone in their organization was going to make $15 an hour, when a lot of them were making as little as 8 or 9. So just those kind of big changes really start to happen. It's one of my favorite stories of a community coming together and really changing the circumstances of the entire community.
Thanks, Paul. It sounds like getting the community to own an issue by providing data is one of the steps.
Owning, well, and dialogue, but data and dialogue, those are the 2 sweet spots.
What would you say was the key ingredient or more than one ingredient that made that a success that we should really ensure in every collective impact project? What are the 1 or 2 key ingredients?
Yeah, it's multi-sector. It has to be a multi-sector response, right? That's key. And a commitment to learning our way to a new way. It's a bit like the way we're going to get out of COVID is not through science alone, right? It's going to be a whole bunch of different behaviors, and we don't even know what those are yet, right? I think that social distancing or physical distancing, staying at home, is the lowest common denominator. At some point, we can't all just stay home. So now we got to learn our way out of this one. Think about that. Almost every major social problem that's facing us, it's a behavioral change that is going to be required at a systemic level. And that means that we need a broad level of commitment to that change. And it can't just be one sector that's driving that change.
I'm mindful of time, Paul. I suppose one last question, if you can allow me maybe to insert another one, but this question is about indicators, all right? There's this notion that because of the way social services are funded by programs and the KPIs are set, in a program-centric way, it in a way impedes the ability to think collectively and achieve collectively. What is your take on that?
It's like you're living in Canada. That's our biggest problem. What we want, and I've had funders tell me this, right? You only bring me ideas that we know will be successful. Well, if I'm just going to give them that, then we already all know what to do, right? We're entrenched. And funders are notorious in not wanting to take risks with their money. But if we don't take risks, right? What was the saying? Think the way you always thought, and you'll get what you always got. So we're never going to get beyond the problem right?
But how should we fund then, Paul? Sorry to interject. How should we, if you have your way, how should funders be funding to promote collective impact?
Well, I think most importantly, we need to fund collectively. So funders need to start to collaborate together and think about systemic change. I was just meeting with 7 foundations last week exactly about this. And they've gone on a 1-year journey to learn how to fund systems change, right? So first of all, we need to learn how to join into a learning journey. So when we bring, when I say that top 100, I always like 10% of that to be funders, maybe more. And I don't want their money. I say that to them right at the beginning. I don't want your money now. I want your knowledge, your brain, and your time. Come and figure out the problem with us. Come on the learning journey with us. And then decide how you're going to fund us. And sometimes they fund as a collective, right? They'll each put in, let's say, $100,000, and then there's $1 million to get started. So they aren't they're distributing the risk. And they have to get over this point that they're funding something that they can take credit for. One of the most important learnings I've had about evaluating collective impact is that it's about contribution, not attribution. And that's what funders have to learn. How did we contribute to the success of that large-scale change? What role did we play? How have we become smarter? Not how have we funded and how was that money used? A funder is but a partner. And I'm tired of being the recipient of money. I don't like to look at it that way. If a funder is going to be a partner, partner with me. You've got money. It's one of the things you bring. You also have an incredible amount of knowledge because you've been funding all these system players, right? So bring that knowledge to the table. You've got passionate staff. Bring them to the table, right? But don't make me look like a beggar that's coming to you for money and then putting up all these barriers to me getting that money so that I got to think like you to get it. Come and join us. Come sit at the table. Be with us. And then fund us. And I think not-for-profits, we have to think differently as well. We can't just say to funders, we want your money. That's all we want. Because if we get those kind of funders, they're very fickle. They're very much in their own head. We need to bring the funder in as a partner. That they know what assets they have to contribute to the large scale change. And they get very smart about that, right? I tell you, we have had the best relationships with funders, including governments, because we treat them as equals. And it's a marvelous relationship. Once that changes, once the relationship changes from funder-fundee, that power dynamic breaks down and you're at the table together. Obviously, there are funding rules. We know them now as well as the funder does. We want the funder to be successful, but we have to work as a team and they have to learn to fund us in different ways. Right? And what they're looking for is they're contributing to a large scale change. They can't take credit for it.
Well, Paul, thank you very much. I think it's certainly a very fruitful morning for me, and I hope that the participants have found the time spent with us useful and meaningful. Sorry, there's quite a number of fighter jets flying, because I live near a military base. So
oh, you do? They're practicing. Yeah. We can't hear them here. All I know is that we've got like about almost 100 comments in the chat box.
Really,
people from Singapore really like this chat box. Wow, we've never had this in Canada before.
There are many questions, and they are very good questions. And I've sort of tease out some of them and ask you already. So, but I don't think it is possible for us to answer each and every one of them. But I hope that, you know, we have certainly covered some of the main themes that come out from the question. If I could
wonderful
just ask,
questions. I'm just going through them
very
here.
good question, right? Yeah.
So many
Paul,
smart people on this call today. Thank you, everyone.
and you have answered some of them. Yeah. Paul, if I could insert one last question, if I may, before I call this meeting to an end, what do you think is the relationship between collective impact and theory of change? Is there a relationship between these two?
Well, theory of change is a tool that we often use in collective impact. You know, it's like we always ask these three basic questions. What are we doing now? What's the change we want to see? And how do you think that change will occur? And it's really that third question that we want to answer. How do we actually think about change? What's our mental model? And what we find interesting is that when you do that with a diverse group of people, you're actually looking for the diverse theories of change. Everyone comes to the table with their own theory of change. We're not actually that concerned about having one theory of change. We use it as an exercise to open a dialogue so that people can expose their theories of change, and that all of those theories of change can engage with each other. And that then starts to create a new mental model. And ultimately, the new mental model is the common agenda. So you get it? So a theory of change that is collective could be considered the common agenda. It's much harder to achieve when you have 4 different sectors in the room. So we use it at the beginning to facilitate dialogue and to expose difference.
Agreed.
Does that help?
I think, yeah, thanks very much. And I believe this process is not just a one session kind of process, right? It takes over multiple sessions, right?
No, collective impact after a year, you start to see some result. It usually is 2 or 3 years of this kind of work and thinking and moving forward that you start getting your big outcomes.
Right, thank you. So really it's a very fruitful morning for me, and I hope the same for the participants who have taken time to join us. We will be sending you an email with a link to a YouTube video, and this video, this particularly for participants from Singapore. This video presents a project involving 3 schools, the Community Development Council, MSF, a local social service agency, SHINE, Children and Youth Services, and the Singapore Scouts Association, coming together to support families and students in Tampines using the collective impact model. I really like to encourage you to watch this video because it's a very good example of a local initiative of different agencies coming together to try to tackle an issue together.
Well, I mean, first of all, thank you. Thank you for your resilience. I know it's morning there. It's 10:30 at night here for us and 10:30 in the morning there for you. There are still 350 people on this call. It started out with 362. So in webinar world, you're a great audience. So I wish I could see all of you and meet all of you. And maybe when, you know, COVID goes away, I know that Wee Peng has wanted me to come to Singapore, and I have promised him that when everything is clear, I will come. And we'll visit together and meet many of you in person. And we'd love to have more webinars with you if you'd like. Also know that if you, you know, if you're a late night person, join Tamarack webinars. They're usually at midnight Singapore time or 1 in the morning Singapore time. So if you're having trouble sleeping, just check in with us. We probably have a webinar going.